Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for making us a part of your day once again. Going to have a conversation with Dr. Amanda Sheehan of Oakland Family Dental, and she's joining us to talk about the importance of periodontal exams as part of prenatal care, and also to give us some tips on keeping gingivitis under control. Thank you for joining us on the program this morning, Dr. Sheehan.
Thank you for having me, Neil. I'm very excited to be here.
Now, I did, of course, mention that you were with Oakland Family Dental, and you've basically dedicated your life to helping the people who are most in need of dental care. Give us a bit of your background and talk about your passion for dentistry.
Thank you. So, yes, I'm a general dentist, so we treat all phases of patients' care. You know, I wanted to be a dentist since I was a child because I just had this fascination for teeth and helping people. And what's shocking is how your overall oral health and what's going on in your mouth can affect your entire body. And as I start to learn more about that, the much I start to realize how much everything's really interconnected.
Now, is that why it's so important that we talk about periodontal exams as part of prenatal care? How does that work, and why is it so important?
So, oftentimes patients will realize that it's very important, to go and see your OB while you're pregnant, but, your mouth, actually there's a change in the hormones, of course, when you're pregnant, right? So your mouth actually starts to change and you start to get some gingivitis from those hormonal changes. And that will actually cause the bacteria to cause some inflammation, and it can actually cause periodontal disease. And we have found that the periodontal disease like that can actually affect the baby. So, different things like low birth weight or preterm delivery have been linked to periodontal disease. So that's why it's really important that you make sure that you get your teeth cleaned and you get checked by your dentist to find out, how you're doing. And sometimes we actually ask the patient to have an additional cleaning while they're pregnant just to prevent any problems with the baby.
What about the prenatal vitamins that are taken during pregnancy? Aren't those designed to maybe offset some of the changes that happen in a woman during pregnancy? Or is that something that I'm mistaken about?
So the prenatal vitamins help for obviously healthy growth with the baby, and it also helps keep, the teeth strong and, make sure that the baby develops properly. And it may help to a certain extent, but the thing is the bacteria still remains in the mouth, and that bacteria changes when it's, in the gums. And if you start to get a little inflammation, because a lot of times pregnant women feel nauseous or they can't even brush their teeth as well as they normally would before. So there's all these changes that happen with the bacteria, and that's what actually causes the gums to become inflamed. And once you start to notice that they're inflamed or bleeding is when the cascade starts to get a little bit worse. And so you're right in saying that, of course, you want to take your prenatal vitamins, but, the dental hygienist actually cleans everything and makes sure that bacteria gets removed.
We're not suggesting that pregnancy causes an unhealthy dental situation. You mentioned that expectant mothers not being able to brush their teeth as often as they did before. Now, are we talking someone that has perfectly healthy teeth? They've been following their dentist recommendations, and now they find themselves pregnant, and alarms should go off?
Well, I will tell you this, a lot of things changes when you're pregnant. We have found a lot of patients, they can't reach all the way back to their back teeth to massage the gums properly because it makes them gag a little bit, or even if they have, everybody is different, of course, right? And some patients will have, a little bit of acid reflux. They have different cravings. So they start eating things differently, or they have a little bit of morning sickness. And that acid like that can start to compromise the teeth and also the gums as well, because that's all going to be changes that their body's not really necessarily used to. We have seen plenty of patients who's never had a cavity in their life. They've never had any sort of problems with their gums, and then they have, any of these issues that we were talking about that are normal with pregnancy, and they start to develop, some bleeding when they're brushing or when they're flossing, because that's when you start to know that we need to have a little bit more attention, because the bleeding is, from the flossing or the brushing is actually a sign of the beginning stages of the infection of the gum, the inflammation or that pregnancy gingivitis that we're talking about. And then over time, that can turn into the periodontitis, and that's the part that is the dangerous part, that we want to make sure that bacteria gets cleaned out. So that way it, improves the mother's health, of course, right, and takes care of their teeth, but it also, has been linked to problems with, the baby. So we want to make sure they're safe as well.
What types of problems are associated with pregnancy as a result of some of these dental issues occurring with the mother?
Yeah, so the biggest thing that we see is, some erosion, which is basically the enamel getting thinner or wearing away directly from acid, because a lot of mothers, of course, have the morning sickness or they have acid reflux. And I was telling you also, they have a difference of what they want to eat sometimes. Sometimes they really want spicy, or they get these late night cravings and they start to develop, a little bit of acid reflux. And that acid in your mouth, it wears away enamel. And the wearing away of the enamel is what causes the cavities, and it also, that acid starts to deteriorate the gums a little bit too.
Now, how is that a potential hazardous situation for the infant?
Yes, because as the gums start to bleed, you see that that's some infection. As the gums are swollen, they start to bleed. That's infection. The bacteria changes with time. Okay, and so when it starts to change from gingivitis bacteria to periodontitis bacteria, that's when it starts to be harmful for the health. Not only is it harmful for the health for the mom, but it's harmful for the health of the baby because that bacteria gets into the bloodstream. Anytime that you have bleeding, that's in your body, right? And so that can get into your system, and that will actually be communicated directly with the baby. Now, the ADA, which is the American Dental Association, says that there is an association between periodontitis and preterm birth, low birth weight babies, and babies being born prematurely, and also preeclampsia. Now, I have to be, clear that these are the things that they're linking. I don't know that we can necessarily say, did it cause that? I don't know, but there's a lot of research being done in this area because we know that it's, potentially very serious.
Is there any way that a woman can come in for her regular checkup? Are there any indications that say, hey, this is gingivitis based on lifestyle, dental habits, whatnot, diet, or this is pregnancy gingivitis? Is there something that tips you off as a dental professional and say, hey, you might want to get a pregnancy test?
Sometimes pregnant women develop little growths on their gums that are more associated with pregnancy, just a little bit of more swelling. It's really the best to be able to compare what did the patient look like before to versus what they look like now to see, is this something that's, normal for the patient, or is this something that they've just developed sort of sporadically? So I don't think that I could say, oh, I'm looking at your mouth, you're definitely pregnant. I feel like that might be a little bit of a stretch. Is it possible? Maybe. But I don't think that might not be in the scope of what we do.
Not yet, anyway.
Not yet. You're right. But what's really important is it's important to understand that the American Dental Association has maintained that it is safe for pregnant women to have their dental work taken care of. You want to make sure that if you need your cleaning, you have your cleaning. If you need your gum treatment, where you have a little bit of a detailed cleaning because you have some gum disease, that you get that taken care of. If you have something that's bothering you, you have a toothache, you want to make sure you get that taken care of too, because over time it's only going to get worse, and potentially cause a bigger problem, and expose the baby to unnecessary stress, or infection.
Now, about 70% of women, I do understand, develop this inflammation of the gums during their pregnancy. What are some helpful tips and hints to avoid or offset the gingivitis during pregnancy?
So you want to be a meticulous brusher and flosser, okay? Nobody really likes to floss except for us in the dental world, I think. But you want to make sure you're brushing 2 to 3 times a day. You want to make sure you're using, over-the-counter fluoride toothpaste, and that you're making sure that you massage the gums and that you're actually flossing. If you get yourself an electric toothbrush, it's going to be a little bit easier to do, and it's going to help with some of the swelling. You also want to make sure that you're using a nice mouth rinse, something that's endorsed by the ADA, like Listerine, which is good for killing that bacteria like we were talking about. And a lot of patients suffer from morning sickness. So you want to make sure that if you're suffering from that, you go ahead and, rinse your mouth out with some water and spit that out. So that way the acid is not sitting, and causing damage to your gums and your teeth.
Well, where can our listeners go online and get some more information about Oakland Family Dental and some more information about prenatal dental care?
So if you want to have more information about Oakland Family Dental, we're at oaklandfamilydental.com, or you can actually find us on Facebook at Oakland Family Dental. And, there's actually an article from the ADA. You just go ahead and search for the American Dental Association, and you can type in pregnancy, and you'll get a lot of recommendations.
Dr. Sheehan, thank you so much for joining us here on Health Professional Radio.
Neil, thank you.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.